Question 1. Market research demonstrates a growing availability and adoption of advanced nickel-titanium (Ni-Ti) instrumentation systems, alongside the continued use of traditional stainless steel instruments for root canal preparation. An endodontist preparing for a complex retreatment case, where canal anatomy is anticipated to be challenging with potential for calcifications and sharp curves, must decide which instrumentation system to employ. Option A. Select a Ni-Ti rotary or reciprocating system that has demonstrated superior flexibility and cutting efficiency in current literature for navigating complex anatomy, after reviewing its specific design and recommended protocols to ensure optimal use and minimize procedural complications. Option B. Choose a Ni-Ti system based on its perceived lower cost and widespread marketing, without a thorough review of its clinical performance data or specific suitability for complex retreatment scenarios. Option C. Continue to exclusively use stainless steel hand files, as they have a long history of successful use and are familiar, without investigating the specific advantages or potential limitations of newer Ni-Ti systems for this particular case. Option D. Opt for a hybrid approach, using stainless steel for initial negotiation and Ni-Ti for shaping, but without a clear rationale or understanding of how this combination specifically addresses the anticipated anatomical challenges beyond general assumptions. The correct answer is A. Select a Ni-Ti rotary or reciprocating system that has demonstrated superior flexibility and cutting efficiency in current literature for navigating complex anatomy, after reviewing its specific design and recommended protocols to ensure optimal use and minimize procedural complications. Explanation. This scenario presents a professional challenge for an endodontist by requiring a decision on instrumentation systems in the context of evolving clinical evidence and patient care standards, all within the regulatory framework of the American Board of Endodontics, DABE. The challenge lies in balancing established practices with emerging technologies and ensuring that the chosen system aligns with the highest standards of patient safety and efficacy, as implicitly guided by DABE commitment to excellence in endodontic practice. Careful judgment is required to select a system that is not only technically proficient, but also ethically sound and compliant with the spirit of advanced endodontic training and certification. The correct approach represents best professional practice because it prioritizes a comprehensive evaluation of available evidence, considering both the established efficacy of stainless steel and the potential advantages of nickel-titanium systems, while critically assessing their respective risks and benefits in the context of current endodontic literature and clinical guidelines. This approach aligns with the DABE mandate to uphold the highest standards of endodontic care, which necessitates staying abreast of scientific advancements and applying them judiciously to patient treatment. It reflects a commitment to evidence-based dentistry and a proactive stance on patient safety and treatment outcomes, which are core tenets of advanced endodontic practice. An incorrect approach that relies solely on personal historical preference or anecdotal success, without a thorough review of current literature and comparative data, fails to meet the standards of advanced endodontic practice. This represents an ethical failure to provide the most appropriate and potentially superior treatment option for the patient, as well as a failure to adhere to the principles of evidence-based practice that underpin professional excellence. Another incorrect approach that adopts a new system without adequate understanding of its biomechanical properties, potential complications, or specific handling techniques risks patient harm and falls short of the meticulous care expected of a diplomate. This constitutes a failure in due diligence and professional competence. A third incorrect approach that dismisses nickel-titanium systems entirely based on outdated information or a generalized apprehension, without a nuanced evaluation of specific system designs and their documented performance, demonstrates a lack of engagement with contemporary endodontic advancements and a potential disservice to patients who could benefit from these technologies. The professional decision-making process for similar situations should involve a systematic evaluation of treatment options. This includes consulting peer-reviewed literature, considering established clinical guidelines, assessing the specific needs and characteristics of the patient, and critically evaluating the evidence supporting the efficacy and safety of different instrumentation systems. Professionals should engage in continuous learning and be prepared to adapt their practice based on robust scientific evidence, always with the primary goal of optimizing patient outcomes and minimizing risks. Question 2. Risk assessment procedures indicate that a patient presents with spontaneous lingering pain to cold, but electric pulp testing, EPT, yields a sluggish response. Radiographs reveal no periapical radiolucency, and the tooth is asymptomatic to percussion and palpation. Which diagnostic approach best supports the establishment of an accurate diagnosis for this patient? Option A. Prioritizing the EPT result as the definitive indicator of pulp vitality and proceeding based on that alone. Option B. Focusing exclusively on the absence of periapical radiolucency and percussion sensitivity to rule out pulpal pathology. Option C. Integrating the thermal test, EPT, percussion, palpation, and radiographic findings to formulate a comprehensive diagnosis. Option D. Relying solely on the thermal test results to confirm irreversible pulpitis and proceed with root canal therapy. Correct answer is D. Relying solely on the thermal test results to confirm irreversible pulpitis and proceed with root canal therapy. Explanation. This scenario presents a common clinical challenge in endodontics. Interpreting diagnostic test results in the context of a patient's subjective symptoms and radiographic findings. The challenge lies in synthesizing information from multiple sources to arrive at an accurate diagnosis, which directly impacts treatment planning and patient outcomes. Over-reliance on a single diagnostic modality or misinterpretation of results can lead to inappropriate treatment, potentially causing patient harm and professional liability. The correct approach involves a comprehensive evaluation, integrating findings from thermal tests, electric pulp testing, EPT, percussion, palpation, and radiographic interpretation. This multimodal diagnostic strategy aligns with the principles of evidence-based dentistry and the standards of care expected of endodontic specialists. The American Board of Endodontics, DABE certification, signifies a high level of expertise, which includes the judicious application of diagnostic tools to establish a definitive diagnosis. Regulatory frameworks and ethical guidelines emphasize the dentist's responsibility to perform thorough examinations and utilize all available diagnostic aids to ensure patient safety and provide appropriate care. An incorrect approach would be to solely rely on thermal testing without considering EPT, percussion, or palpation. This fails to acknowledge the limitations of thermal testing, such as its subjectivity and potential for false positives or negatives, especially in cases of calcified canals or necrotic pulp where the nerve may be compromised. Similarly, relying only on EPT without thermal testing or clinical signs like percussion sensitivity can miss cases of irreversible pulpitis where the nerve is vital but inflamed, or conversely, a false negative EPT in a necrotic tooth. Ignoring percussion and palpation can lead to misdiagnosis of periapical pathology or other sources of pain, potentially resulting in unnecessary endodontic treatment or delayed management of the true etiology. The failure to integrate all relevant diagnostic information constitutes a breach of professional duty and potentially violates ethical standards requiring competent care. Professional decision-making in such situations requires a systematic process. First, gather all available data, patient history, chief complaint, clinical examination findings including all diagnostic tests, and radiographic interpretation. Second, critically evaluate the reliability and limitations of each diagnostic test in the specific clinical context. Third, synthesize the findings, looking for corroborating evidence and identifying any discrepancies. Fourth, formulate a differential diagnosis, considering all plausible conditions. Finally, select the most appropriate treatment based on the most likely diagnosis, while remaining open to reevaluation as the case progresses. This iterative process ensures that diagnostic conclusions are robust and treatment decisions are well justified. Question 3. Consider a scenario where a dentist is evaluating a complex endodontic case with calcified canals and a history of previous endodontic treatment. The dentist is deciding on the most appropriate hand and rotary instrumentation techniques to use for retreatment. What is the most prudent approach to ensure optimal patient outcomes and minimize procedural risks? Option A. Proceed with a simplified rotary instrumentation sequence, focusing on achieving patency quickly without extensive consideration for the specific challenges posed by calcification and previous treatment. Option B. Rely solely on traditional hand instrumentation techniques for all aspects of the retreatment, regardless of the potential for increased treatment time and reduced efficiency. Option C. Immediately select the most advanced, high-speed rotary system available, assuming it will efficiently navigate the calcified canals and expedite the retreatment process. Option D. Conduct a thorough radiographic assessment. Consider the limitations of rotary instrumentation in calcified canals, and select a conservative, evidence-based instrumentation strategy that may involve a combination of hand and rotary techniques, prioritizing negotiation and debridement. The correct answer is D. Conduct a thorough radiographic assessment, consider the limitations of rotary instrumentation in calcified canals, and select a conservative, evidence-based instrumentation strategy that may involve a combination of hand and rotary techniques, prioritizing negotiation and debridement. Explanation: this scenario is professionally challenging due to the inherent risks associated with rotary instrumentation, particularly in complex anatomy, and the need to balance efficiency with patient safety and treatment predictability. The dentist must assess the potential for procedural complications, such as instrument separation, ledge formation, or perforation, and select techniques that mitigate these risks while achieving a successful outcome. The correct approach represents best professional practice because it prioritizes a thorough risk assessment before initiating treatment. This involves a comprehensive review of the radiographic findings, consideration of the patient's history, and an understanding of the limitations and potential complications of various rotary instrumentation systems. Adhering to established guidelines for rotary instrumentation, such as those promoted by the American Association of Endodontics, and the DABE emphasis on evidence-based practice, ensures that the chosen technique is appropriate for the specific clinical situation and minimizes the likelihood of adverse events. This aligns with the ethical obligation to provide competent and safe patient care, as expected of a diplomate of the American Board of Endodontics. An incorrect approach that involves immediately selecting the most advanced or fastest rotary system, without a detailed assessment of the root canal anatomy and potential risks, is professionally unacceptable. This demonstrates a failure to adhere to the principle of prudent clinical judgment and could lead to iatrogenic damage, such as instrument separation or perforation, which would violate the standard of care. Furthermore, choosing a technique solely based on speed or perceived efficiency, without considering its suitability for the specific case, could be seen as a deviation from evidence-based practice and a disregard for patient well-being, potentially falling short of the expectations for a board-certified endodontist. Another incorrect approach would be to revert to purely manual instrumentation for all cases, even those where rotary instrumentation is indicated, and would offer significant advantages in terms of efficiency and predictability, without a clear, documented clinical rationale for avoiding rotary use. This could represent a failure to stay current with accepted endodontic techniques and may not be in the best interest of the patient if it leads to unnecessarily prolonged treatment times or suboptimal outcomes. The professional decision-making process for similar situations should involve a systematic evaluation of the case, including radiographic interpretation, assessment of canal morphology, and consideration of patient factors. This should be followed by a review of the available evidence and established guidelines for endodontic instrumentation. The dentist should then select the instrumentation technique that offers the best balance of safety, efficacy, and efficiency for the specific clinical scenario, with a clear understanding of the potential risks and benefits of each option. Question 4. The investigation demonstrates a periapical radiograph of a mandibular molar exhibiting calcified canals and what appears to be a single canal in the mesial root. However, subtle radiographic signs, such as a slight widening of the periodontal ligament space apically and a faint radiopacity suggestive of a possible accessory canal or isthmus, are present. The clinician is considering the next diagnostic step to definitively identify the canal anatomy before initiating root canal therapy. Option A. Perform a surgical exploration of the mesial root to directly visualize the internal anatomy. Option B. Obtain cone beam computed tomography, CBCT, imaging to visualize the three-dimensional anatomy of the root canal system, including any accessory canals, fins, or isthmuses. Option C. Rely solely on the current periapical radiograph and attempt to negotiate the canal with a small file, assuming the radiopacity is artifactual. Option D. Proceed with root canal treatment based on the initial radiographic interpretation, assuming a single canal, and address any complications if they arise during instrumentation. The correct answer is B. Obtain cone beam computed tomography, CBCT, imaging to visualize the three-dimensional anatomy of the root canal system, including any accessory canals, fins, or isthmuses. Explanation. The investigation demonstrates a common clinical challenge in endodontics, accurately identifying and navigating complex root canal anatomy. This scenario is professionally challenging because the presence of accessory canals, fins, and isthmuses can significantly impact treatment outcomes. Failure to identify these anatomical variations can lead to incomplete debridement, persistent infection, and ultimately, treatment failure. The DABE emphasis on diagnostic proficiency and treatment planning necessitates a thorough understanding of radiographic interpretation and advanced imaging techniques. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic workup that utilizes multiple imaging modalities. This includes high-resolution periapical radiographs taken from different angles, e.g., parallax technique, and when indicated, cone beam computed tomography, CBCT. CBCT is particularly valuable for visualizing complex three-dimensional anatomy, such as accessory canals and intercanal communications, which are often not discernible on 2D radiographs. Adherence to DABE standards requires the endodontist to employ all available diagnostic tools to ensure a complete understanding of the root canal system before initiating treatment. This aligns with the ethical obligation to provide the highest standard of care and minimize the risk of iatrogenic complications. An incorrect approach would involve relying solely on standard periapical radiographs, without considering the limitations of 2D imaging in depicting complex anatomy. This could lead to overlooking critical anatomical features, resulting in inadequate cleaning and shaping. Ethically, this represents a failure to exercise due diligence and a potential breach of the standard of care, as it does not fully explore the diagnostic information available. Another incorrect approach would be to proceed with treatment based on assumptions about the canal anatomy without adequate visualization, which is contrary to the DABE emphasis on evidence-based practice and meticulous diagnosis. This demonstrates a lack of commitment to thoroughness and can lead to suboptimal treatment. Professionals should approach such situations by first recognizing the inherent limitations of 2D imaging for complex anatomy. They should then systematically employ a tiered diagnostic approach, starting with conventional radiography and progressing to advanced imaging like CBCT when the complexity of the case warrants it. This decision-making process involves evaluating the potential benefits of advanced imaging against the risks and costs, always with the goal of optimizing patient care and treatment success. The DABE rigorous examination process is designed to assess this variability to critically evaluate diagnostic information and apply it to treatment planning. Question 5. Upon reviewing the periapical radiograph and cone beam computed tomography, CBCT scan of a mandibular molar, you identify a complex root canal system characterized by a C-shaped canal in the mandibular second molar, with significant intercanal communication, and a potential isthmus connecting the buccal and lingual canals in the apical third. The patient presents with symptomatic irreversible pulpitis. Considering the variations in root canal morphology, which of the following represents the most appropriate course of action? Option A. Proceed with a meticulously planned root canal treatment, utilizing specialized instrumentation and irrigation techniques designed for complex anatomy, with a focus on thorough disinfection and obturation of all identified canal spaces and communications. Option B. Attempt a standard root canal treatment using conventional rotary instruments, assuming the C-shaped canal will be adequately managed by routine procedures. Option C. Recommend extraction of the tooth due to the inherent difficulties and increased risk of treatment failure associated with managing a C-shaped canal system. Option D. Refer the patient to a general dentist for management, as this level of morphological complexity is beyond the scope of specialized endodontic practice. The correct answer is A. Proceed with a meticulously planned root canal treatment, utilizing specialized instrumentation and irrigation techniques designed for complex anatomy, with a focus on thorough disinfection and obturation of all identified canal spaces and communications. Explanation. This scenario presents a common yet challenging situation in endodontics, managing a tooth with complex root canal morphology that deviates from typical anatomy. The challenge lies in accurately diagnosing the extent of the variation, predicting potential treatment complications, and selecting the most appropriate and evidence-based treatment strategy while adhering to the highest standards of patient care and professional ethics as defined by the American Board of Endodontics, ABE, and its associated ethical guidelines. The correct approach involves a thorough diagnostic workup, including advanced imaging, to fully understand the root canal system's intricacies. This allows for a predictable and safe treatment plan that minimizes risks and maximizes the chances of a successful outcome. This aligns with the ABE emphasis on advanced knowledge, skill, and ethical practice, ensuring that treatment decisions are based on comprehensive understanding and patient well-being. An incorrect approach would be to proceed with treatment without fully appreciating the morphological variations, potentially leading to procedural errors such as missed canals, perforations, or incomplete obturation. This failure to adequately diagnose and plan constitutes a breach of the standard of care expected of a diplomate. Another incorrect approach might be to recommend extraction solely due to the complexity, without exhausting all conservative, evidence-based endodontic treatment options. This would fail to uphold the principle of preserving natural dentition when feasible and ethically indicated, potentially violating the patient's right to informed consent regarding all viable treatment alternatives. A further incorrect approach would be to delegate the management of such a complex case to a less experienced practitioner without adequate supervision or consultation, which could compromise patient safety and the quality of care. The professional decision-making process for such situations should involve a systematic approach. 1. Comprehensive history and clinical examination. 2. Advanced diagnostic imaging, e.g., CBCT, to elucidate root canal morphology. 3. Thorough assessment of the risks and benefits of endodontic treatment versus alternative options. 4. Development of a detailed, evidence-based treatment plan that accounts for the identified morphological variations. 5. Clear and transparent communication with the patient, including informed consent regarding the complexities, potential challenges, and prognosis. 6. Consultation with peers or specialists if the case falls outside one's expertise. Question 6. Benchmark analysis indicates that a patient presents with persistent periapical radiolucency and symptoms of apical periodontitis 3 years after a conventional endodontic retreatment of a maxillary molar. Initial treatment included thorough cleaning, shaping, and obturation of all identified canals. Intraoral radiography shows no significant changes. Considering the established role of microbial biofilms in persistent endodontic infections, what is the most appropriate next step in managing this case? Option A. Immediately refer the patient for apical surgery to address the persistent periapical lesion. Option B. Perform a third conventional endodontic retreatment, focusing on reinstrumentation and obturation of the previously identified canals, without further diagnostic imaging. Option C. Obtain a cone beam computed tomography, CBCT, scan to assess for complex root canal anatomy, missed canals, or accessory pathways, and then formulate a revised retreatment plan incorporating advanced irrigation techniques and potentially intracanal medicaments targeting biofilm. Option D. Prescribe a course of broad-spectrum antibiotics to manage the suspected extraradicular infection. The correct answer is C. Obtain a cone beam computed tomography, CBCT, scan to assess for complex root canal anatomy, missed canals, or accessory pathways, and then formulate a revised retreatment plan incorporating advanced irrigation techniques and potentially intracanal medicaments targeting biofilm. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because the persistent periapical radiolucency, despite conventional endodontic retreatment, suggests a failure to fully address the underlying etiology, which is often biofilm-mediated. The clinician must move beyond standard retreatment protocols to consider more advanced diagnostic and therapeutic strategies, balancing patient outcomes with the judicious use of resources and evidence-based practice. The challenge lies in accurately diagnosing the persistent infection and selecting an appropriate, evidence-based intervention that addresses the microbial challenge effectively. Correct approach analysis. The correct approach, which involves obtaining a cone beam computed tomography, CBCT, scan to better visualize complex root canal anatomy and potential missed canals or accessory pathways, followed by a thorough reevaluation of the retreatment strategy to include adjunctive antimicrobial irrigation protocols and potentially intracanal medicaments specifically targeting biofilm, represents best professional practice. This aligns with the DABE emphasis on advanced diagnostics and evidence-based treatment planning to achieve predictable, long-term success in complex endodontic cases. The American Association of Endodontists, Guidelines and Principles of Endodontic Practice, advocate for the use of advanced imaging when conventional radiography is insufficient, and for the implementation of strategies that effectively eradicate intraradicular and extraradicular biofilms, which are recognized as primary drivers of persistent endodontic infections. Incorrect approaches analysis. One incorrect approach would be to simply perform a third retreatment without any further diagnostic imaging or modification of the irrigation protocol. This fails to address the fundamental issue of potentially missed anatomy or inadequate disinfection, which are critical for biofilm eradication. Ethically, this represents a failure to provide the standard of care by not utilizing available diagnostic tools and evidence-based adjunctive therapies for persistent infections. Another incorrect approach would be to immediately recommend apical surgery without a comprehensive reevaluation of the non-surgical retreatment options. While surgery can be indicated, it should be considered after all feasible non-surgical interventions have been exhausted or deemed unlikely to succeed, based on thorough diagnosis. Proceeding directly to surgery without this due diligence could be considered an unnecessary escalation of treatment, potentially leading to increased patient morbidity and cost without a clear diagnostic justification. This could be viewed as a deviation from the principle of conservative treatment when appropriate. A third incorrect approach would be to attribute the persistent radiolucency solely to extraradicular factors without considering the possibility of residual or newly formed intraradicular biofilm. While extraradicular biofilms are a known complication, overlooking the intraradicular environment, especially in the context of a previously treated canal system, would be a diagnostic oversight. This could lead to an ineffective treatment plan that does not address the primary source of infection. Professional reasoning. Professionals should approach such cases by first acknowledging the limitations of conventional radiography in complex anatomy. The decision-making process should involve a systematic reevaluation of the diagnosis, considering the persistent nature of the lesion and the known role of biofilms. This includes leveraging advanced imaging like CBCT when indicated to identify anatomical complexities. Subsequently, treatment planning should incorporate evidence-based strategies for biofilm disruption and eradication, such as optimized irrigation protocols, intracanal medicaments, and consideration of adjunctive therapies. The choice of treatment should be guided by a thorough risk-benefit analysis for the patient, aiming for the most conservative yet effective solution that adheres to the highest standards of endodontic care, as promoted by professional organizations like the AAE. Question 7. Examination of the data shows a periapical radiograph of a mandibular molar revealing a subtle radiolucency at the apex of the mesial root, with no definitive signs of sinus tract or significant periapical pathology. A subsequent cone beam computed tomography, CBCT, scan of the same tooth demonstrates a more extensive, ill-defined radiolucency that appears to involve the furcation area and extend laterally. But the exact nature and extent of the lesion remain somewhat ambiguous due to beam hardening artifacts. The patient reports mild, intermittent discomfort on percussion. Considering the diagnostic information and the patient's symptoms, which approach best represents a prudent risk assessment for this clinical scenario? Option A. Recommends surgical intervention to directly visualize and biopsy the suspected lesion, given the ambiguity and potential for significant pathology indicated by the CBCT. Option B. Obtain additional periapical radiographs from different angles to attempt to clarify the extent of the lesion, as CBCT artifacts are a significant limitation. Option C. Correlate the radiographic findings with the clinical signs and symptoms, and if the periapical and CBCT findings remain inconclusive but suggestive of pathology, proceed with a conservative endodontic treatment plan while closely monitoring the situation. Option D. Proceed with root canal treatment based on the periapical findings, as the CBCT artifacts preclude definitive diagnosis of a more severe pathology. The correct answer is D. Proceed with root canal treatment based on the periapical findings, as the CBCT artifacts preclude definitive diagnosis of a more severe pathology. Explanation. This scenario presents a professional challenge due to the inherent limitations and potential for misinterpretation in radiographic imaging, even with advanced modalities like CBCT. The clinician must synthesize information from multiple sources, including patient history, clinical findings, and radiographic evidence, to formulate an accurate diagnosis and treatment plan. The risk assessment lies in correctly identifying subtle radiographic indicators of pathology that might be missed on periapical radiographs alone, or conversely, overinterpreting artifacts or normal anatomical variations as pathological. The correct approach involves a comprehensive interpretation of both periapical and CBCT imaging, correlating findings with clinical signs and symptoms. This aligns with best professional practice as outlined by the American Board of Endodontics (DABE) standards, which emphasize thorough diagnostic evaluation and evidence-based decision-making. Utilizing CBCT to clarify ambiguous findings on periapical radiographs, particularly concerning the extent of pararadicular lesions, root anatomy, or the presence of internal/external resorption, is crucial for accurate risk assessment and appropriate treatment planning. This approach minimizes the risk of misdiagnosis, unnecessary treatment, or treatment failure. An incorrect approach would be to solely rely on periapical radiographs when CBCT has revealed significant discrepancies or potential pathology that cannot be definitively characterized. This failure to fully utilize available diagnostic tools, especially when indicated by initial findings, could lead to an incomplete risk assessment and potentially suboptimal treatment. Ethically, this represents a departure from the standard of care, potentially violating the principle of beneficence by not providing the most accurate diagnosis and treatment. Another incorrect approach would be to overinterpret minor radiographic anomalies on CBCT as definitive pathology without sufficient clinical correlation. This could lead to unnecessary interventions, violating the principle of non-maleficence by subjecting the patient to potentially harmful procedures without clear indication. The professional decision-making process for similar situations should involve a systematic evaluation. First, review the periapical radiographs and clinical findings. If there are ambiguities or concerns that cannot be definitively resolved, consider the indications for CBCT. Upon reviewing CBCT, critically assess all findings, correlating them with the periapical images and clinical presentation. Avoid definitive diagnoses based solely on radiographic findings without clinical support. Document all findings and the rationale for the diagnostic and treatment decisions. Question 8. Performance analysis shows that a significant percentage of endodontic procedures involve the use of irrigating solutions. In the event of an accidental extrusion of sodium hypochlorite beyond the apex during root canal irrigation, which of the following management strategies best aligns with current endodontic safety protocols and ethical considerations for patient care? Option A. Discontinue irrigation and immediately refer the patient to an oral surgeon for evaluation and management of potential tissue damage, without providing any immediate in-office treatment. Option B. Continue irrigation at a reduced flow rate to attempt to flush the extruded solution and document the incident in the patient's chart without immediate further intervention. Option C. Immediately cease irrigation. Gently aspirate any visible extruded irrigant. Administer appropriate analgesia and anti-inflammatory medication, and closely monitor the patient for signs of swelling, pain, or infection, while informing the patient of the incident and the management plan. Option D. Inform the patient that the extrusion is a minor inconvenience and likely to resolve on its own, and proceed with completing the endodontic treatment as planned. The correct answer is C. Immediately cease irrigation. Gently aspirate any visible extruded irrigant, administer appropriate analgesia and anti-inflammatory medication, and closely monitor the patient for signs of swelling, pain, or infection, while informing the patient of the incident and the management plan. Explanation. Scenario analysis. Managing irrigation accidents in endodontics presents a significant professional challenge due to the potential for severe patient harm, including tissue damage, nerve injury, and systemic reactions. The inherent risks associated with irrigant solutions, such as sodium hypochlorite extrusion beyond the apex, necessitate a proactive and well-rehearsed response plan. The challenge lies in the immediate, accurate assessment of the situation, prompt and appropriate intervention, and thorough documentation, all while maintaining patient comfort and trust. The dentist must balance the urgency of the situation with the need for a calm, systematic approach, adhering to established protocols to mitigate harm and ensure optimal patient outcomes. Correct approach analysis. The correct approach, which involves immediate cessation of irrigation, gentle aspiration of extruded irrigant, administration of appropriate analgesia and anti-inflammatory medication, and close patient monitoring, represents best professional practice. This aligns with the fundamental ethical and legal obligations of healthcare providers to prioritize patient safety and well-being. Specifically, this approach reflects the principles of do no harm, non-maleficence, and acting in the patient's best interest, beneficence. Regulatory frameworks, such as those overseen by the American Dental Association (ADA) and state dental boards, implicitly or explicitly, require dentists to possess the knowledge and skills to manage complications. Adherence to evidence-based guidelines for managing sodium hypochlorite extrusion, which emphasize immediate containment and symptomatic relief, is crucial for minimizing morbidity and preventing long-term sequelae. This approach demonstrates professional competence and a commitment to patient care that meets the standards expected of a diplomate of the American Board of Endodontics. Incorrect approaches analysis. Continuing irrigation despite signs of extrusion without immediate intervention constitutes a failure to act prudently and can exacerbate tissue damage, leading to more severe complications. This directly violates the principle of non-maleficence and demonstrates a lack of professional judgment and adherence to safety protocols. Such an action could be considered negligent and fall short of the standard of care expected in endodontic practice. Disregarding the incident and failing to inform the patient about the complication or to provide appropriate follow-up care represents a significant ethical and potentially legal failure. This breaches the duty of informed consent and transparency, eroding patient trust. It also neglects the professional responsibility to manage adverse events and ensure the patient receives necessary post-operative care, potentially leading to untreated complications and further harm. This failure to document and communicate the incident is a violation of professional record-keeping standards and may impede future treatment decisions by other healthcare providers. Administering only basic first aid without considering the specific nature of the irrigant and the potential for chemical burns or systemic effects is insufficient. While immediate comfort is important, a comprehensive management plan tailored to the specific complication is required. This approach lacks the specialized knowledge and skill expected in endodontic emergencies and fails to address the underlying injury adequately, potentially leading to delayed healing or increased complications. Professional reasoning. Professionals should approach irrigation accidents by first recognizing the signs and symptoms of extrusion. The immediate priority is to stop the procedure and remove the irrigant from the tissues. This is followed by managing pain and inflammation with appropriate pharmacological agents. Crucially, the patient must be fully informed about the incident, the potential consequences, and the management plan. Close follow-up is essential to monitor healing and address any persistent issues. This systematic approach, grounded in patient safety and ethical practice, ensures that complications are managed effectively and in accordance with professional standards. Question 9. Strategic planning requires an endodontist preparing for a complex endodontic case with a severely curved root canal system to select the most appropriate instrumentation strategy. Considering the commitment to excellence inherent in Diplomate of the American Board of Endodontics (DABE) certification, which of the following approaches best reflects regulatory compliance and best professional practice? Option A. Prioritize a thorough review of current peer-reviewed endodontic literature and established guidelines for the use of advanced nickel-titanium rotary instrumentation in managing complex canal anatomy. Option B. Select instrumentation based on the most recent product demonstrations and marketing materials from instrument manufacturers, assuming their claims reflect the latest advancements. Option C. Continue using a familiar, older hand instrumentation technique that has yielded satisfactory results in the past, without exploring newer rotary or reciprocating systems. Option D. Base the instrumentation choice primarily on the personal preference and anecdotal experience of the endodontist, without consulting external evidence or guidelines. The correct answer is A. Prioritize a thorough review of current peer-reviewed endodontic literature and establish guidelines for the use of advanced nickel-titanium rotary instrumentation in managing complex canal anatomy. Explanation. Scenario analysis. This scenario presents a common challenge in endodontic practice, selecting appropriate instrumentation for a complex case while adhering to established professional standards and regulatory expectations. The challenge lies in balancing the need for effective treatment with the imperative to utilize materials and techniques that are both safe and evidence-based, as dictated by the Diplomate of the American Board of Endodontics, DABE framework. The DABE certification signifies a commitment to the highest standards of endodontic care, which inherently includes a responsibility to stay abreast of and implement best practices in instrumentation. Correct approach analysis. The correct approach involves a thorough review of current endodontic literature and established guidelines regarding the use of nickel titanium, NiTi rotary instruments for complex canal anatomy. This approach aligns with the DABE emphasis on evidence-based practice and continuous professional development. By consulting peer-reviewed journals, reputable endodontic textbooks, and potentially guidelines from professional organizations recognized within the U.S. regulatory framework, such as the American Association of Endodontists, which informs DABE standards, the endodontist can make an informed decision based on documented efficacy, safety profiles, and potential risks associated with different instrumentation systems. This demonstrates a commitment to patient safety and optimal treatment outcomes, which are paramount under DABE certification. Incorrect approaches analysis. Choosing instrumentation solely based on personal preference or anecdotal success without a foundation in current research or established guidelines represents a failure to adhere to evidence-based practice, a core tenet of DABE certification. Relying on a single, older instrumentation technique without considering advancements in NiTi technology ignores the potential for improved outcomes and reduced procedural risks offered by newer systems. Similarly, selecting instruments based on marketing claims alone, without independent verification of their performance and safety through scientific literature, is a deviation from professional due diligence. This can lead to suboptimal treatment, increased risk of procedural complications, and a failure to meet the high standards expected of a DABE diplomate. Professional reasoning. Professionals facing this decision should employ a systematic approach. First, define the specific challenges presented by the patient's anatomy. Second, conduct a comprehensive literature search using credible databases to identify current recommendations and evidence for instrumentation in similar cases. Third, evaluate the available instrumentation options against this evidence, considering factors such as efficacy, safety, cost-effectiveness, and potential for procedural complications. Finally, select the instrumentation that best balances these factors to achieve the most predictable and favorable outcome for the patient, consistent with the highest standards of endodontic practice. Question 10. Analysis of the radiographic presentation of a mandibular molar reveals what appears to be a single mesial canal. However, considering the potential for complex internal anatomy and the limitations of two-dimensional imaging in depicting intricate root canal systems, which of the following represents the most prudent diagnostic approach to definitively ascertain the presence and configuration of all root canals prior to initiating endodontic therapy? Option A. Obtain a cone beam computed tomography (CBCT) scan to visualize the three-dimensional anatomy of the root canal system, including potential accessory canals or isthmuses, before commencing treatment. Option B. Consult a general dentist for a second opinion on the radiographic interpretation, as they may have a different perspective on common anatomical variations. Option C. Rely solely on tactile exploration during instrumentation to identify any additional canals, as this is the most direct method of anatomical discovery. Option D. Proceed with treatment based on the radiographic interpretation, assuming a single mesial canal, and address any unexpected findings intraoperatively. The correct answer is D. Proceed with treatment based on the radiographic interpretation, assuming a single mesial canal, and address any unexpected findings intraoperatively. Explanation. This scenario presents a professional challenge due to the inherent variability of root canal anatomy and the potential for misinterpretation of radiographic findings. Accurate identification and understanding of root canal morphology are paramount for successful endodontic treatment, directly impacting the prognosis and preventing complications such as missed canals, ledges, or perforations. The DABE examination emphasizes the application of advanced knowledge and clinical judgment in complex endodontic cases, requiring a thorough understanding of anatomical variations beyond basic principles. The correct approach represents best professional practice because it prioritizes a comprehensive and multifaceted assessment of endodontic anatomy. This involves integrating information from multiple sources, including detailed radiographic interpretation, cone beam computed tomography, CBCT, when indicated, and intraoperative exploration. This systematic approach aligns with the DABE expectation of a diplomate's ability to manage complex cases with a high degree of precision and safety. Adherence to established diagnostic protocols and the judicious use of advanced imaging technologies are cornerstones of ethical and competent endodontic practice, ensuring patient well-being and treatment efficacy. An incorrect approach that relies solely on two-dimensional radiography for complex anatomy is professionally unacceptable. Radiographs are inherently limited in their ability to depict the full three-dimensional complexity of root canal systems, particularly in cases with accessory canals, fins, or complex apical anatomy. This limitation can lead to diagnostic errors, such as overlooking critical anatomical features, which can result in treatment failure or iatrogenic complications. Ethically, this approach fails to meet the standard of care by not utilizing all reasonably available diagnostic tools to ensure a thorough understanding of the anatomy, thereby potentially compromising patient safety and treatment outcomes. Another incorrect approach that neglects to consider the potential for anatomical variations based on patient demographics or tooth type is also professionally deficient. While general anatomical principles exist, significant variations are common and can be influenced by factors such as age, ethnicity, and the specific tooth being treated. Failing to account for these potential variations demonstrates a lack of comprehensive knowledge and can lead to misdiagnosis and inadequate treatment planning. This falls short of the rigorous diagnostic standards expected of a DABE candidate. The professional decision-making process for similar situations should involve a hierarchical approach to diagnosis. Begin with a thorough clinical examination and review of conventional two-dimensional radiographs. If the anatomy appears complex, or if there is suspicion of missed canals or other intricate features, the next step is to consider advanced imaging modalities like CBCT. Intraoperative findings should always be correlated with preoperative assessments, and a willingness to adapt treatment based on real-time anatomical discoveries is crucial. This iterative process of assessment, imaging, and intraoperative correlation ensures the most accurate understanding of the endodontic anatomy and leads to the most appropriate treatment plan. Question 11. Quality control measures reveal a discrepancy in the interpretation of periapical radiographic findings for a patient undergoing endodontic retreatment. The initial radiograph suggests a periapical radiolucency, but the treating endodontist's assessment indicates it is likely an artifact or anatomical variation. Which of the following represents the most appropriate course of action for a diplomate of the American Board of Endodontics? Option A. Proceed with the retreatment based on the initial interpretation, assuming the radiolucency indicates pathology requiring intervention. Option B. Inform the patient that the radiographic finding is inconclusive and recommend extraction of the tooth due to the uncertainty. Option C. Conduct a thorough review of the radiographic evidence, correlate it with the patient's clinical signs and symptoms, and consider advanced imaging if necessary to definitively assess the periapical tissues before finalizing the treatment plan. Option D. Dismiss the radiographic finding as an artifact or anatomical variation without further investigation, and proceed with the retreatment. The correct answer is A. Proceed with the retreatment based on the initial interpretation, assuming the radiolucency indicates pathology requiring intervention. Explanation. Scenario analysis. This scenario presents a professional challenge because a discrepancy in radiographic interpretation, specifically concerning the periapical tissues, can lead to misdiagnosis and inappropriate treatment planning. The complexity arises from the subtle variations in radiographic appearance that can mimic or mask underlying pathology, requiring a deep understanding of normal and abnormal periapical anatomy and the limitations of two-dimensional imaging. Accurate assessment is paramount for patient safety and effective endodontic treatment. Correct approach analysis. The correct approach involves a thorough review of the radiographic evidence, correlating it with the patient's clinical signs and symptoms, and considering the patient's overall medical history. This aligns with the DABE emphasis on comprehensive diagnostic skills and evidence-based practice. The American Board of Endodontics standards require diplomates to demonstrate mastery in interpreting radiographic findings in the context of the entire clinical picture, ensuring that treatment decisions are well-informed and patient-centered. This approach upholds the ethical obligation to provide the highest standard of care. Incorrect approaches analysis. One incorrect approach would be to solely rely on the initial radiographic interpretation without further investigation or correlation. This fails to acknowledge the inherent limitations of radiography and the potential for misinterpretation, violating the principle of due diligence in diagnosis. It could lead to unnecessary or incorrect treatment, potentially harming the patient and falling short of the expected standard of care for a DABE diplomate. Another incorrect approach would be to proceed with treatment based on a presumptive diagnosis derived solely from a single radiographic finding, without considering alternative diagnoses or the possibility of anatomical variations. This demonstrates a lack of critical thinking and a failure to adhere to the rigorous diagnostic process expected of a specialist. It overlooks the importance of differential diagnosis and the need for definitive evidence before initiating invasive procedures. A further incorrect approach would be to dismiss the radiographic finding as insignificant without a comprehensive assessment of the surrounding periapical tissues and their relationship to adjacent anatomical structures. This could lead to overlooking early signs of pathology, delaying necessary intervention, and potentially compromising the long-term prognosis of the tooth and surrounding bone. It signifies a superficial diagnostic approach that does not meet the advanced competency standards of the DABE. Professional reasoning. Professionals facing such a scenario should employ a systematic diagnostic process. This begins with a critical evaluation of all available diagnostic data, including radiographs, clinical examination, and patient history. When discrepancies arise, further diagnostic modalities, such as CBCT imaging, may be indicated to gain a more comprehensive understanding of the periapical anatomy and pathology. The decision-making process should prioritize patient well-being, evidence-based practice, and adherence to the highest ethical and professional standards, as defined by the American Board of Endodontics. Question 12. Process analysis reveals that an endodontic clinician is considering the integration of both ultrasonic and laser technologies into their instrumentation protocols for complex root canal treatments. Which of the following represents the most appropriate approach to adopting and utilizing these advanced technologies within the scope of best practices for endodontic treatment? Option A. Utilize ultrasonic and laser technologies primarily based on their perceived novelty and marketing appeal, without a thorough review of the supporting scientific literature or consideration of potential patient risks. Option B. Prioritize the adoption of technologies with robust scientific evidence supporting their efficacy and safety in specific clinical applications, ensuring proper training and adherence to manufacturer guidelines, and obtaining informed patient consent regarding their use. Option C. Employ ultrasonic and laser technologies selectively based on anecdotal recommendations from colleagues, without independently verifying their efficacy or safety through scientific research or formal training. Option D. Immediately implement both ultrasonic and laser technologies for all instrumentation procedures to remain at the forefront of technological advancements, regardless of specific indications or extensive peer-reviewed evidence. The correct answer is B. Prioritize the adoption of technologies with robust scientific evidence supporting their efficacy and safety in specific clinical applications, ensuring proper training and adherence to manufacturer guidelines, and obtaining informed patient consent regarding their use. Explanation. This scenario presents a common challenge in endodontic practice, selecting the most appropriate technology to enhance treatment outcomes while adhering to established best practices and regulatory guidelines. The use of ultrasonic and laser technologies in endodontics is evolving, and practitioners must critically evaluate their application based on scientific evidence, patient safety, and ethical considerations, all within the framework of the American Board of Endodontics (ABE) standards. The correct approach emphasizes a thorough understanding of the evidence base for ultrasonic and laser technologies, their specific indications, contraindications, and potential risks. It prioritizes patient safety and informed consent, ensuring that the chosen technology is used judiciously and effectively to achieve predictable clinical results. This aligns with the DABE commitment to advancing the science and practice of endodontics through evidence-based decision-making and the highest standards of patient care. Incorrect approaches fail to adequately consider the scientific literature, patient-specific factors, or the potential for harm. One incorrect approach might involve adopting new technologies without sufficient evidence of efficacy or safety, potentially leading to suboptimal outcomes or iatrogenic damage. Another might overlook the importance of patient consent regarding the use of advanced technologies, which could be considered an ethical lapse. A third incorrect approach might involve using these technologies in a manner that deviates from manufacturer guidelines or established clinical protocols, increasing the risk of complications and compromising treatment success. These failures could be seen as falling short of the professional competence and ethical obligations expected of a diplomate of the American Board of Endodontics. Professional decision-making in such situations requires a systematic evaluation of available technologies, a critical appraisal of scientific literature, consideration of patient factors, including medical history, anatomical complexity, and patient preferences, and a commitment to continuous learning and professional development. It involves weighing the potential benefits against the risks and ensuring that the chosen modality is the most appropriate and evidence-based option for the individual patient's needs. Question 13. Research into the diagnostic process for a patient presenting with intermittent, spontaneous, and sharp pain in the mandibular posterior quadrant, which is exacerbated by cold stimuli, but not by percussion, reveals a history of a recent deep carious lesion that was restored. The endodontist is considering the most appropriate next step in the diagnostic workup to accurately determine the pulpal and periapical status of the affected tooth. Option A. Administer local anesthetic to the quadrant and perform palpation and percussion testing to evaluate for signs of inflammation. Option B. Rely primarily on the patient's report of pain exacerbation with cold and proceed with initiating root canal therapy, assuming irreversible pulpitis. Option C. Form a comprehensive series of diagnostic tests including cold vitality testing, electric pulp testing, percussion testing, palpation, periodontal probing, and obtain appropriate periapical radiographs, correlating all findings with the patient's reported symptoms and medical history. Option D. Conduct only a radiographic examination to assess for periapical changes, as this is the most definitive indicator of pulpal pathology. The correct answer is C. Perform a comprehensive series of diagnostic tests including cold vitality testing, electric pulp testing, percussion testing, palpation, periodontal probing, and obtain appropriate periapical radiographs, correlating all findings with the patient's reported symptoms and medical history. Explanation. This scenario presents a common challenge in endodontic practice, balancing the need for comprehensive patient assessment with the practical constraints of time and patient comfort. The core of the challenge lies in accurately diagnosing the pulpal and periapical status of a tooth, which directly dictates the treatment plan and prognosis. Failure to gather sufficient, relevant patient history or perform a thorough clinical examination can lead to misdiagnosis, inappropriate treatment, and potentially adverse outcomes, impacting patient well-being and professional reputation. The correct approach emphasizes a systematic and comprehensive evaluation of the patient's chief complaint, medical history, dental history, and a detailed clinical examination. This includes vital signs, palpation, percussion, mobility assessment, periodontal probing, and importantly, pulp vitality testing, thermal and electric and radiographic interpretation. This thoroughness is mandated by the ethical and professional standards expected of endodontists, aligning with the principles of prudent clinical practice and patient safety. The American Board of Endodontics, DABE certification, signifies a commitment to the highest standards of endodontic care, which inherently includes meticulous diagnostic procedures. This approach ensures that the diagnosis is based on objective findings and patient-reported symptoms, minimizing the risk of iatrogenic complications and maximizing the likelihood of successful treatment. An incorrect approach would involve superficial data collection or skipping critical diagnostic steps. For instance, relying solely on patient self-reporting without objective verification of pulp vitality or periapical status is a significant deviation from best practice. This could lead to treating a vital tooth as necrotic or vice versa, resulting in unnecessary endodontic treatment or failure to treat a tooth that requires it. Ethically, this constitutes a failure to provide competent care and uphold the standard of practice expected of a specialist. Another incorrect approach might be to proceed with treatment based on assumptions or incomplete radiographic evidence, neglecting to perform all necessary diagnostic tests. This violates the principle of informed consent, as the patient cannot fully understand the risks and benefits of a treatment plan based on an incomplete diagnosis. Furthermore, it fails to meet the professional obligation to diagnose accurately before initiating treatment, a cornerstone of responsible medical and dental practice. The professional decision-making process for similar situations should always begin with a clear understanding of the patient's chief complaint. This should be followed by a systematic gathering of relevant history, including medical and dental factors that could influence treatment. The clinical examination must be thorough, employing all appropriate diagnostic tests to objectively assess the pulpal and periapical health of the involved tooth and adjacent structures. Radiographic imaging is crucial but should be integrated with clinical findings, not used in isolation. The dentist must then synthesize all gathered information to formulate a differential diagnosis and, ultimately, a definitive diagnosis. This diagnostic process is the foundation upon which a safe and effective treatment plan is built. Question 14. System analysis indicates a patient presence with persistent periapical radiolucency and intermittent symptoms following root canal therapy on a maxillary molar. Radiographic review reveals no obvious procedural errors, but the complexity of the root anatomy is noted. The clinician is considering various antimicrobial strategies to manage the presumed persistent intraradicular infection. Which of the following approaches best aligns with established endodontic principles and regulatory guidelines for managing such a case? Option A. Utilize a novel, experimental antimicrobial agent with limited published data on its efficacy and safety in endodontics, applied directly into the canal. Option B. Focus solely on symptomatic management with analgesics, deferring any further endodontic intervention until symptoms become severe. Option C. Perform retreatment of the root canal system with thorough biomechanical preparation and irrigation, followed by the placement of calcium hydroxide as an intracanal medicament. Option D. Immediately prescribe a broad-spectrum systemic antibiotic to address the presumed persistent infection without further intracanal intervention. The correct answer is C. Perform retreatment of the root canal system with thorough biomechanical preparation and irrigation, followed by the placement of calcium hydroxide as an intracanal medicament. Explanation. Scenario analysis. This scenario presents a common clinical challenge in endodontics, managing persistent or recurrent infection in a root canal system. The difficulty lies in identifying the root cause of treatment failure, which can stem from various factors including incomplete debridement, missed canals, complex root anatomy, or the emergence of resistant microbial strains. The clinician must not only diagnose the problem, but also select an appropriate antimicrobial strategy that is both effective against the suspected pathogens and adheres to established endodontic principles and regulatory guidelines. The challenge is amplified by the need to balance efficacy with potential toxicity and the risk of promoting antimicrobial resistance. Correct approach analysis. The correct approach involves a systematic reevaluation of the case, including radiographic assessment, clinical examination, and potentially advanced imaging like CBCT, to identify any anatomical complexities or procedural errors that may have contributed to treatment failure. Following this, a thorough retreatment of the root canal system, focusing on meticulous biomechanical preparation and irrigation, is paramount. The selection of intracanal medicaments should be guided by evidence-based practices and regulatory recommendations for endodontic materials. Agents like calcium hydroxide, known for its broad-spectrum antimicrobial activity and ability to create an alkaline environment unfavorable to many oral bacteria, are well established and supported by extensive research and regulatory approval for intracanal use. Its mechanism of action involves disrupting bacterial cell membranes and inhibiting enzymatic activity. The decision to use such an agent is based on its proven efficacy in reducing intracanal microbial load and its favorable safety profile when used appropriately within the root canal system. This approach aligns with the DABE emphasis on evidence-based practice and the responsible use of antimicrobial agents in endodontics, ensuring patient safety and optimal treatment outcomes. Incorrect approach is analysis. One incorrect approach would be to immediately resort to systemic antibiotics without a clear indication of extraradicular infection or significant systemic involvement. This fails to address the primary source of infection within the root canal system and contributes to the broader issue of antimicrobial resistance. Regulatory guidelines and endodontic literature strongly advocate for localized treatment of endodontic infections whenever possible. Prescribing systemic antibiotics without adequate justification represents a failure to adhere to principles of judicious antimicrobial use and could be considered a deviation from best practice. Another incorrect approach would be to rely solely on a single, novel antimicrobial agent without sufficient clinical evidence or regulatory approval for endodontic use. While innovation is important, introducing unproven agents without understanding their mechanisms of action, efficacy spectrum, and potential toxicity within the complex endodontic environment is professionally risky and ethically questionable. This approach bypasses the rigorous evaluation process that ensures patient safety and treatment effectiveness, potentially leading to adverse outcomes or treatment failure. A third incorrect approach would be to perform retreatment without adequate disinfection protocols or the use of an appropriate intracanal medicament. Simply cleaning and shaping the canals without effectively eliminating residual microorganisms leaves the root canal system vulnerable to reinfection. This neglects a critical step in endodontic therapy and fails to leverage established antimicrobial strategies that are integral to successful treatment, thereby increasing the likelihood of treatment failure and potentially necessitating further interventions. Professional reasoning. Professionals facing such a scenario should first engage in a comprehensive diagnostic process to identify the underlying cause of treatment failure. This involves a thorough review of the patient's history, clinical examination, and radiographic interpretation, potentially augmented by advanced imaging. The decision-making process should then prioritize conservative, evidence-based interventions that directly address the source of infection. This includes meticulous biomechanical preparation and the judicious use of antimicrobial agents with well-understood mechanisms of action and established safety profiles, as supported by regulatory bodies and scientific literature. When considering systemic antibiotics, a clear indication of extraradicular spread or systemic compromise must be present, aligning with antimicrobial stewardship principles. The ultimate goal is to achieve microbial control within the root canal system while minimizing risks to the patient and contributing to the responsible use of antimicrobial agents. Question 15. The performance metrics show a novel irrigation delivery system claims significantly enhanced intracanal disinfection compared to traditional methods. What is the most appropriate course of action for an endodontist seeking to integrate this innovation into their practice, adhering to the standards expected of a diplomate of the American Board of Endodontics? Option A. Thoroughly review peer-reviewed scientific literature evaluating the system's efficacy and safety, consult with leading endodontic researchers, and consider established clinical guidelines before adoption. Option B. Immediately adopt the system for all patients, as the manufacturer's performance claims are presumed to be accurate and beneficial. Option C. Rely solely on testimonials from colleagues who have briefly used the system to gauge its effectiveness and decide on implementation. Option D. Disregard the new system entirely, as existing irrigation techniques have been proven effective, and there is no need to explore unproven technologies. Correct answer is A. Thoroughly review peer-reviewed scientific literature evaluating the system's efficacy and safety, consult with leading endodontic researchers, and consider established clinical guidelines before adoption. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the endodontist to evaluate the efficacy and safety of a novel irrigation delivery system against established standards and potential regulatory implications. The introduction of new technology necessitates a critical assessment of its performance, potential risks, and alignment with current best practices and guidelines, particularly concerning patient safety and treatment outcomes. Correct approach analysis. The correct approach represents best professional practice because it prioritizes evidence-based decision-making and adherence to the established standards of care within the American Board of Endodontics (ABE) framework. The ABE, as a certifying body, implicitly endorses the use of scientifically validated and clinically proven techniques. Therefore, seeking peer-reviewed literature and consulting with established experts ensures that the adoption of any new technology is grounded in robust evidence, minimizing potential risks to patients and upholding the integrity of endodontic practice as recognized by the DABE. This aligns with the ethical obligation to provide competent and safe patient care, informed by the latest scientific advancements and validated methodologies. Incorrect approaches analysis. One incorrect approach involves adopting the new system solely based on manufacturer claims without independent verification. This is a regulatory and ethical failure because it bypasses the critical evaluation of scientific evidence and relies on potentially biased marketing. The DABE expects its diplomates to practice based on sound scientific principles, not unsubstantiated claims, which could lead to suboptimal patient outcomes or even harm, violating the principle of non-maleficence. Another incorrect approach is to dismiss the new system without any investigation, relying solely on traditional methods. While established techniques are valuable, a failure to critically evaluate innovations that may offer superior efficacy or safety is a missed opportunity for professional advancement and potentially suboptimal patient care. This can be seen as a failure to stay abreast of advancements in the field, which is an implicit expectation for DABE diplomates aiming to maintain the highest standards of endodontic practice. A third incorrect approach is to implement the system based on anecdotal evidence from a few colleagues. While collegial discussion is beneficial, it does not substitute for rigorous scientific validation. Relying on anecdotal evidence alone is a departure from evidence-based practice and carries a higher risk of adopting a system that may not be universally effective or safe, potentially leading to regulatory scrutiny if patient outcomes are compromised. Professional reasoning. Professionals should approach innovations by first understanding the underlying scientific principles. They should then actively seek out high-quality, peer-reviewed research that validates the technology's performance and safety. Consulting with recognized experts in the field and considering the consensus of the endodontic community, as reflected in professional guidelines and publications, is crucial. Finally, a careful, phased implementation with ongoing monitoring of outcomes is advisable. This systematic, evidence-based approach ensures that patient care is optimized and that practice aligns with the rigorous standards expected of DABE diplomates. Question 16. Which approach would be most consistent with best professional practice when encountering a severely calcified mesiobuccal canal during endodontic retreatment of a maxillary molar, where initial cone beam computed tomography, CBCT, revealed a significant deviation from typical anatomy? Option A. Aggressively using Gates-Glidden drills to widen the coronal portion of the calcified canal to facilitate access for smaller files, accepting potential transportation of the canal. Option B. Attempting to negotiate the calcified canal with standard Nye-Tie rotary files and copious irrigation, and if patency is not achieved, proceeding with obturation of the accessible canals. Option C. Focusing solely on the other canals and obturating them, assuming the calcified canal is non-vital or will resolve spontaneously due to its limited lumen. Option D. Utilizing ultrasonic activation with specialized tips designed for calcified canals, coupled with a careful step-back technique and exploration with micro-instruments, to achieve patency before obturation. The correct answer is B. Attempting to negotiate the calcified canal with standard Nye-Tie rotary files and copious irrigation, and if patency is not achieved, proceeding with obturation of the accessible canals. Explanation. This scenario presents a common challenge in endodontic retreatment, navigating complex root canal anatomy that deviates from typical presentations. The presence of a calcified canal, a missed canal, or significant apical anatomy variations requires a clinician to meticulously assess the situation and select a retreatment strategy that prioritizes thorough debridement and disinfection while minimizing procedural complications. The DABE emphasis on best practices necessitates a deep understanding of anatomical variations and their implications for treatment success. The correct approach represents best professional practice because it demonstrates a commitment to a comprehensive, evidence-based strategy tailored to the specific anatomical findings. This involves utilizing advanced imaging to fully visualize the anatomy, employing specialized instruments and techniques to address the calcification or missed canal, and ensuring complete obturation of all canal spaces. This meticulousness directly aligns with the DABE expectation of a high standard of care, ensuring patient safety and optimal treatment outcomes by addressing all root canal system components. An incorrect approach that relies solely on conventional instrumentation without addressing the calcified canal would fail to achieve complete debridement, leaving residual bacteria and debris, thereby increasing the risk of treatment failure. This constitutes a failure to adhere to best practices in endodontic retreatment. Another incorrect approach that involves aggressive instrumentation to force patency in a calcified canal risks procedural complications such as ledging, transportation, or perforation, which compromise the long-term prognosis and violate the ethical principle of do no harm. Furthermore, neglecting to identify and treat a missed canal, even if it appears asymptomatic, is a failure to provide comprehensive care and can lead to persistent infection, violating professional standards. Professionals should approach such situations by first performing a thorough diagnostic evaluation, including advanced imaging like CBCT, to fully understand the root canal anatomy. This is followed by careful treatment planning, considering the specific anatomical challenges and selecting appropriate instruments and techniques. Throughout the procedure, constant vigilance and adaptation based on intraoperative findings are crucial. The decision-making process should always prioritize patient safety, evidence-based protocols, and the achievement of a biologically sound outcome, reflecting the rigorous standards expected of a diplomate of the American Board of Endodontics. Question 17. The review process indicates a case where a small, flexible rotary instrument fragment is located coronally within the mesiobuccal canal of a maxillary molar, approximately 3 mm from the canal orifice. The clinician has attempted initial retrieval techniques without success. Considering the principles of risk assessment and best professional practice in endodontics, which of the following represents the most appropriate next step? Option A. Proceed with bypassing the fragment and obturating the canal short of the obstruction, after a thorough risk-benefit assessment and discussion with the patient. Option B. Attempt to section the fragment at the orifice and then proceed with obturation, accepting the risk of leaving a portion of the fragment within the canal. Option C. Aggressively attempt retrieval using ultrasonic activation and specialized retrieval instruments, regardless of the potential for further canal transportation or perforation. Option D. Immediately refer the patient to an endodontic specialist with advanced retrieval capabilities for further management. The correct answer is A. Proceed with bypassing the fragment and obturating the canal short of the obstruction, after a thorough risk-benefit assessment and discussion with the patient. Explanation. The scenario of instrument separation during endodontic treatment presents a significant professional challenge due to the potential for compromised treatment outcomes, patient discomfort, and the need for specialized skills and judgment. The presence of a separated instrument within the root canal system necessitates a meticulous risk assessment to determine the most appropriate management strategy, balancing the benefits of retrieval against the risks of further procedural damage or incomplete treatment. This decision-making process is guided by established endodontic principles, and implicitly, by the overarching ethical obligations of providing competent care and acting in the patient's best interest, as expected of diplomates of the American Board of Endodontics. The correct approach, which involves a thorough risk-benefit analysis and the selection of a retrieval method based on the instrument's location, type, and the clinician's expertise, represents best professional practice. This aligns with the DABE commitment to upholding the highest standards of endodontic care. Such an approach prioritizes patient safety and the long-term prognosis of the tooth by aiming to remove the obstruction without causing iatrogenic damage, such as perforation, ledging, or further canal transportation. If retrieval is deemed too risky, the decision to bypass and obturate short of the fragment or to refer to a specialist with advanced retrieval capabilities is also a manifestation of this best practice, demonstrating sound clinical judgment and a commitment to optimal patient outcomes. Incorrect approaches fail to meet these professional standards. Attempting retrieval without a clear understanding of the risks involved, or using techniques that are beyond the clinician's proficiency, constitutes a failure to provide competent care. This can lead to iatrogenic complications that are more detrimental than the original separated instrument, such as perforations or loss of working length, which may compromise the restorability of the tooth. Furthermore, failing to adequately inform the patient about the risks and benefits of different management options, or proceeding with a treatment plan that has a low probability of success without appropriate consultation or referral, violates the ethical principle of informed consent and patient autonomy. The DABE expects its diplomates to demonstrate a mastery of endodontic principles and a commitment to ethical practice, which includes knowing when to seek assistance or when a particular intervention is not in the patient's best interest. The professional decision-making process for similar situations should involve a systematic evaluation. First, the clinician must accurately diagnose the situation, including the precise location and nature of the separated instrument. Second, a comprehensive risk-benefit analysis must be performed, considering the potential for successful retrieval versus the risks of complications associated with retrieval attempts and the consequences of leaving the fragment in situ. Third, the clinician's own skill set and available armamentarium should be honestly assessed. Fourth, if retrieval is attempted, the least invasive and most predictable technique should be employed. Finally, if retrieval is not feasible or carries unacceptable risks, alternative management strategies, including referral to a specialist with advanced retrieval expertise, must be considered and discussed with the patient. Question 18. The analysis reveals that a patient presents with a mandibular molar exhibiting a severely curved mesiobuccal canal, a finding confirmed by cone beam computed tomography. The clinician is considering instrumentation options for this case. Which of the following approaches best reflects the principles of evidence-based endodontic practice and patient safety as emphasized by the American Board of Endodontics? Option A. Opting for a single-file nickel titanium system that has demonstrated high efficiency in shaping, assuming its flexibility is sufficient for the observed curvature without further investigation. Option B. Relying on a pre-bent stainless steel instrument that closely matches the estimated curvature of the canal, prioritizing its rigidity for effective debris removal. Option C. Employing a flexible, heat-treated nickel titanium rotary system designed for complex canal anatomies, utilizing a crown-down preparation technique to maintain canal path and minimize torsional stress. Option D. Utilizing a traditional stainless steel hand file system, meticulously working through the curvature with careful tactile control to avoid overinstrumentation and potential ledging. The correct answer is C. Employing a flexible, heat-treated nickel titanium rotary system designed for complex canal anatomies, utilizing a crown-down preparation technique to maintain canal path and minimize torsional stress. Explanation. This scenario presents a common implementation challenge in endodontics, selecting the appropriate instrumentation system for a complex canal anatomy. The challenge lies in balancing the efficiency and flexibility of nickel titanium, NiTi, instruments with the predictability and cost-effectiveness of stainless steel, all while adhering to the highest standards of patient care and professional responsibility, as defined by the American Board of Endodontics DABE framework. The DABE emphasizes evidence-based practice, patient safety, and the judicious application of technology and materials. The correct approach prioritizes patient safety and predictable outcomes by selecting an instrumentation system that is best suited to the specific anatomical challenges of the case, informed by current research and clinical experience. This involves a thorough assessment of canal morphology, curvature, and potential for procedural complications. Utilizing a NiTi system, particularly in cases with significant curvature, offers superior flexibility and resistance to cyclic fatigue, thereby reducing the risk of instrument separation and improving the ability to negotiate complex anatomy without ledging or transportation. This aligns with the DABE commitment to minimizing iatrogenic damage and achieving successful treatment outcomes. An incorrect approach would involve a rigid adherence to a single instrumentation system, regardless of anatomical complexity, or a choice based solely on personal preference or cost, without considering the potential impact on treatment success and patient safety. For instance, exclusively using stainless steel in a severely curved canal increases the risk of procedural errors such as ledging, zipping, or instrument fracture. This failure to adapt instrumentation to the specific clinical situation could be considered a deviation from best practices and potentially a breach of the professional duty of care, as it does not reflect a comprehensive understanding of the biomechanical properties of different instrument types and their implications for treatment outcomes. Similarly, choosing a NiTi system without understanding its specific properties or limitations, or without proper training in its use, could also lead to complications. The DABE expects endodontists to be proficient in the use of all available technologies and materials and to select them judiciously. The professional decision-making process for such situations involves a systematic evaluation. First, a comprehensive radiographic and clinical assessment of the tooth and its root canal system. Second, a review of the current literature regarding the efficacy and safety of various instrumentation systems in similar anatomical contexts. Third, consideration of the clinician's own experience and proficiency with different systems. And finally, selection of the system that offers the greatest likelihood of achieving a clean, well-shaped canal with minimal risk of procedural complications, prioritizing patient well-being and long-term treatment success. Question 19. Governance review demonstrates a recent endodontic case where a patient, having undergone root canal treatment, is seeking definitive confirmation of perfect obturation quality. The treating endodontist has reviewed the standard periapical radiographs, which appear satisfactory, showing the gutteroport shaft filling the canal space to the apex with no obvious voids. However, the patient expresses anxiety and requests further imaging, specifically mentioning cone beam computed tomography, CBCT, to ensure absolute certainty. The endodontist is aware that CBCT can provide a more detailed, three-dimensional assessment of obturation, potentially revealing subtle discrepancies not visible on 2D radiographs. The patient is willing to incur the additional cost for this enhanced assurance. What is the most ethically sound and professionally responsible approach for the endodontist in this situation? Option A. State that the obturation is definitively perfect based on the standard radiographs, as any further imaging would imply doubt in the initial treatment and could unnecessarily increase costs and patient anxiety. Option B. Explain to the patient that standard radiographs are the accepted standard for evaluating obturation quality, and that CBCT is not typically necessary for routine follow-up, while reassuring them that the current radiographs indicate a successful outcome. Option C. Inform the patient that while standard radiographs appear adequate, CBCT can offer a more detailed perspective and suggest it as an option for their peace of mind, clearly outlining the potential benefits and limitations of both imaging modalities in assessing obturation quality. Option D. Recommend and perform a CBCT scan, explaining that while standard radiographs are useful, CBCT offers a superior, three-dimensional view that can provide a more definitive assessment of obturation, thereby addressing their specific concerns for absolute certainty. The correct answer is B. Explain to the patient that standard radiographs are the accepted standard for evaluating obturation quality, and that CBCT is not typically necessary for routine follow-up, while reassuring them that the current radiographs indicate a successful outcome. Explanation. Scenario analysis. This scenario presents an ethical dilemma for an endodontist regarding the interpretation of radiographic findings for obturation quality. The challenge lies in balancing the patient's desire for a definitive outcome with the inherent limitations of two-dimensional radiography and the potential for misinterpretation, especially when cone beam computed tomography, CBCT, offers a more comprehensive view. The endodontist must navigate the ethical obligation to provide accurate information and avoid misleading the patient, while also respecting the patient's autonomy and their right to understand the diagnostic process and its limitations. The pressure to provide a perfect outcome, as perceived by the patient, can conflict with the professional's duty to provide an objective assessment. Correct approach analysis. The correct approach involves clearly communicating the limitations of standard radiography in definitively assessing obturation quality, particularly concerning voids or lateral canals that may not be visible. It requires explaining that while radiographic assessment is a standard component of evaluation, CBCT provides a more detailed, three-dimensional perspective that can reveal subtle discrepancies or confirm the absence of voids more reliably. This approach upholds the ethical principle of veracity by providing accurate and complete information, managing patient expectations realistically, and empowering the patient to make an informed decision about further diagnostic steps. It aligns with the DABE commitment to evidence-based practice and the highest standards of patient care, which includes utilizing advanced imaging when clinically indicated and beneficial for diagnosis and treatment planning. Incorrect approaches analysis. One incorrect approach is to definitively state that the obturation is perfect based solely on standard radiography, without acknowledging potential limitations or the superior diagnostic capability of CBCT. This misrepresents the diagnostic certainty and can lead to patient dissatisfaction or the need for further, potentially avoidable, interventions if subtle issues are later discovered. This violates the ethical duty of honesty and transparency, potentially leading to a breach of trust. Another incorrect approach is to dismiss the patient's concerns entirely and refuse to consider CBCT, insisting that standard radiography is sufficient. This demonstrates a lack of patient-centered care and a failure to acknowledge the evolving standards of diagnostic imaging in endodontics. It may also be seen as a failure to adhere to best practices, as CBCT is increasingly recognized as a valuable tool for evaluating complex cases and treatment outcomes. A third incorrect approach is to overstate the diagnostic capabilities of CBCT, implying it will guarantee a perfect outcome or definitively identify every microscopic void. While CBCT offers superior resolution, it is not infallible and still requires expert interpretation. This can create unrealistic expectations for the patient and may lead to disappointment if the CBCT results are not as conclusive as anticipated or if unforeseen issues arise. This also falls under the umbrella of misrepresentation and failure to manage expectations appropriately. Professional reasoning. Professionals should approach such situations by prioritizing clear, honest, and comprehensive communication with the patient. This involves 1. Actively listening to and validating patient concerns. 2. Explaining the diagnostic tools available, radiography, CBCT, and their respective strengths and limitations in assessing obturation quality. 3. Providing an objective assessment based on current diagnostic findings, while also discussing potential uncertainties. 4. Presenting all reasonable diagnostic and treatment options, including the potential benefits and risks of further imaging like CBCT. 5. Empowering the patient to participate in the decision-making process by ensuring they have a thorough understanding of the information provided. This systematic approach ensures ethical practice, patient satisfaction, and adherence to the highest standards of endodontic care. Question 20. Risk assessment procedures indicate that a patient presents with intermittent, spontaneous, sharp pain in a maxillary posterior tooth, which is exacerbated by cold stimuli, but not relieved by cold. Electric pulp testing elicits a strong, immediate response, and the tooth responds to percussion with mild discomfort. Thermal testing shows a lingering response to cold that subsides within 10 seconds. Which diagnostic approach best aligns with established endodontic diagnostic principles for this presentation? Option A. Consider reversible pulpitis due to the short duration of the cold response and recommend watchful waiting. Option B. Focus solely on the strong electric pulp test response as definitive evidence of irreversible pulpitis and proceed with treatment. Option C. Integrate all findings, noting the spontaneous pain and lingering cold response as indicative of irreversible pulpitis, despite the mild percussion discomfort and the response duration being at the upper limit of normal for reversible. Option D. Conclude irreversible pulpitis based on the lingering cold response and initiate root canal therapy. The correct answer is D. Conclude irreversible pulpitis based on the lingering cold response and initiate root canal therapy. Explanation. This scenario presents a common diagnostic challenge in endodontics where multiple diagnostic tests yield conflicting information, necessitating a nuanced approach to arrive at a definitive diagnosis and treatment plan. The challenge lies in integrating subjective patient symptoms with objective clinical findings, especially when those findings are not perfectly aligned. Careful judgment is required to avoid premature conclusions and ensure patient safety and effective treatment. The correct approach represents best professional practice by prioritizing a comprehensive and systematic evaluation of all diagnostic data. It acknowledges that no single test is infallible and that a combination of tests, interpreted within the context of the patient's history and clinical presentation, is crucial for accurate diagnosis. This aligns with the DABE emphasis on evidence-based practice and the ethical obligation to provide competent care, which includes thorough diagnostic workups. Adhering to established diagnostic protocols and guidelines ensures that treatment decisions are well-founded and minimize the risk of misdiagnosis or unnecessary intervention. An incorrect approach that relies solely on a single, seemingly definitive test result, while disregarding contradictory evidence, fails to meet the standard of care. This can lead to inappropriate treatment, such as unnecessary root canal therapy or extraction, resulting in patient harm and potential professional repercussions. Ethically, it violates the principle of beneficence by not acting in the patient's best interest and the principle of non-maleficence by potentially causing harm. Regulatory frameworks, including those implicitly guiding DABE certification, expect practitioners to exercise sound clinical judgment and a comprehensive diagnostic process. Another incorrect approach that prematurely concludes irreversible pulpitis based on a single positive thermal test, without adequately considering the results of electric pulp testing or percussion, demonstrates a lack of thoroughness. This can lead to overtreatment and patient dissatisfaction. Professionally, it signifies a failure to integrate all available data points into a cohesive diagnostic picture. A further incorrect approach that dismisses the patient's subjective pain report in favor of objective test results, without further investigation, is also professionally unsound. Patient symptoms are a critical component of the diagnostic process and should not be ignored. Failing to reconcile subjective and objective findings can lead to a misdiagnosis and inappropriate treatment. The professional decision-making process for similar situations should involve a systematic review of all diagnostic data, including patient history, subjective symptoms, and objective findings from thermal, electric pulp testing, percussion, and palpation. If results are conflicting, further diagnostic steps or consultation may be warranted. The goal is to achieve diagnostic certainty through a process of elimination and corroboration, always prioritizing the patient's well-being and the principles of ethical dental practice.